All right, good evening, everyone. My name is Spiro Spanakis. I'm the president of the Worcester District Medical Society. It's my pleasure to welcome you to our event this evening. This is our first event of this type, our Med Moth holiday program. Our event will be moderated by our two student members, student Dr. Timothy Winn and student Dr. Meg Ruddy. I want to thank the student committee. They've been very active over the past year and have helped us put on some great programs, both for other students and young physicians, and also events like this evening. So before we get started, I want to introduce student Dr. Tim Winn, who is a fourth-year medical student at the UMass Chan Medical School. He's pursuing a career in emergency medicine. Before attending medical school, he had two prior careers, one working as a software engineer in the defense industry, and then an additional 5 years working as a registered nurse in the neonatal ICU in several Boston hospitals. In medical school, Tim has been involved with the medical humanities through Dr. Dave Hatem's creative writing elective. Dr. Hatem will be one of our presenters this evening, and also served as one of my attendings when I was an intern many years ago. Tim has also participated in the Healers Art elective led by Dr. Rebecca Spanakis, and by sharing a story at a Med Moth a few years ago before helping co-lead it. Student Dr. Meg Ruddy is a fourth-year student at the UMass Chan Medical School. She is currently applying to internal medicine. She was a psychology major and an English minor in undergrad, and has a passion for narrative medicine. She has enjoyed coordinating Med Moth events since her first year of medical school. You can see her here pictured on the screen. So at this time, I'd like to hand over the virtual podium to Tim and Meg to introduce our presenters. Thank you.
Great, thank you so much, Dr. Spanakis. And good evening, everyone, and welcome to Med Moth. So I'm Tim, and thanks again for that lovely introduction. It's our 11th evening together for Med Moth, and we really appreciate all the support that we've received over the last 5 years. This is our first time partnering with Worcester District Medical Society for an event. And we'd really like to thank Martha Wright and Melissa Boucher for making this event happen, as well as third-year medical student Calvin Schaefer for bringing us all together. Before we jump in, just a few more acknowledgements to our advisors, Dr. Mike Ennis, Dave Hatem, and you Silk, as well as the Lamar Sutter Library staff, who are always tremendous supporters of Med Moth and repeatedly help make this event possible. And of course, thanks to my better half in all ways, Meg Ruddy, who has been a great co-leader of Med Moth over the last 2 years with me. And most of all, our utmost gratitude goes to all the storytellers who are sharing with us tonight. So I'll hand it off to Meg to introduce the first speaker.
Thank you so much, Tim. So our first speaker this evening will be Dr. Dave Hatem, who it sounds like is a fan favorite of everyone, not just Med Moth. Dr. Hatem is a professor of medicine in the Department of Internal Medicine at UMass Chan Medical School and has been a general internist at UMass since 1988. He was a founding co-director of the UMass Learning Communities and is a Burncoat House mentor. He is the recipient of multiple teaching awards, including the Chancellor's Medal for Distinguished Teaching in 2016. Dr. Hatem used writing to reflect on his experiences and has taught the writing elective at UMass Chan for more than 20 years. His favorite winter activity is skiing, which he learned as an adult, and it has changed the way that he has enjoyed the winter. He will be sharing a story this evening about how he continues to struggle with the ups and downs of the COVID pandemic, but how he found hope in an unexpected way on a Saturday at home. Take it away, Dr. Hatem.
Thanks so much, Meg and Tim, and to Martha and all the hosts and the storytellers as well. I find that when Tim puts out, and Tim and Meg put out these calls, I say, if you want a story, you know, I'll tell one. And he said yes this time, so I realized, okay, now I have to write it. I told him what it was about before I wrote it. And so I finished it last night. So this is the first time I'm reading this. Whenever that happens, I never quite know what it's going to sound like. I also realized that when we commit to telling stories, you look around and either stories find you or you find the stories. And so it really has been a great motivation to do that. So the name of this piece, at least its first title, is Moving Towards Hope. I looked out the window on a Saturday morning and saw a few stray leaves leaping off trees, floating to the ground, back and forth, swaying up, now down, and thought of the cycle of growing, dying, and gathering as we approach Thanksgiving. It was work, this gathering of the leaves, the scratch, scratch of the rake, timed with my breath as I set out to create some order in this messy yard. My little effort to create some order in this messy world. I had debated with myself on this cool autumn day how many layers I would need for warmth, for comfort, for striking that perfect balance, warm enough, always seeking, always seeking. Besides talking with myself these days, I can listen to podcasts. And today, I started in the front yard, scratch, to the melodic and calming voice of the Brooklyn-born, then Worcester-based Anthony Fauci. Listening first to measured, wise Dr. Fauci, speaking clearly but haltingly, then slowing down, interrupting, then cautioning even the sympathetic host repeatedly not to take his words out of context, since he was certain that despite his best efforts that others would do this, had done this, which had led to loud, all caps, hate mail, threats of harm, even death threats to him and to his family. I was not yet done with the front yard, working on the driveway, the low point of this yard, where all the leaves collect, sitting there, waiting for the garage door to open so they could leap in, maybe even get carried into the house to get warm behind closed doors, protected. And the front yard transformed to full-blown anger as the cautious voice of Dr. Fauci was replaced by a public health physician from Kansas who was trying to apply best evidence to a pandemic that had killed more than 750,000 in the US over 1.5 years. Yet she was thwarted at every turn in newspapers, over radio, at school board meetings, being told that government officials should make this decision about healthcare. No, personal freedom. Because what right did she have to tell people to protect themselves? And how dare she tell them to protect others? The leaves cowered against the garage door. My raking intensified, scratch, digging deeper, scratch, more forcefully, scratch, into the ground, scratch. I transitioned to the backyard, consciously slowing the raking, the digging, dragging the leaves back toward the cluster of trees, their new home, the pile of leaves brought to this shelter from years past, the newly fallen piled on top, deep piles, their decay enriching the soil below. I picked the next podcast deliberately, not content to simply let whatever was coming next just play itself. And in doing this, Brian Stevenson's voice started speaking. Just mercy. A long story of justice and choosing mercy. A man who never knew a lawyer but chose to become one, and then chose to work with people on death row, people who are mentally ill and incarcerated, and children being tried as adults. And as I listened to his voice and the silence and the warmth of composting leaves, I pondered what would move a man to make it his work to speak for the voiceless, speak with the voiceless. And he told us that people are more than the worst thing that they have done. Someone who has stolen something is not just a thief. Someone who has gotten into a fight is not just a thug. They are not to be reduced. They do not become only that one word. And to do this work, to start this journey, you must be proximate, he said. You have to get close enough to the people who are suffering. Hearing this, and hearing that he had worked to get people off death row, suddenly the backyard became hope, but not the hope of I wish, but the hope that he said is what gets us to stand up when others say sit down. I stood there wondering what I could possibly do next, filled with a feeling of hope, but that feeling composting under so many layers of uncertainty, discouragement, despair. As I wondered what I might do to be proximate to suffering and to give hope to the hopeless, I first heard from the son. His father had a sore throat and was coughing. His throat was so painful it was difficult to swallow. After one, then two hopeful rounds of antibiotics, he felt better, we told ourselves. It was just before Thanksgiving, and the son knew enough to figure that not much would get done in the hospital over the holiday. So he negotiated to bring him into the hospital on Monday, not Wednesday. Time did not allow this as he got worse. We found him to be too frail, too much choking, too little intake. So he came reluctantly to be admitted to the hospital. I came in on that Monday, and from then on, I started visiting and planning next steps, seeing my 89-year-old patient hospitalized because all of a sudden he could not swallow, and we had no idea why, and he was losing his voice, and we were trying in vain to figure out why. Each day I saw him with his son, and he would whisper my name, open his eyes wide, and smile. We had discovered a thyroid mass, and as he got weaker lying in bed, using a suction every few minutes to prevent himself from choking on his saliva, we discussed our plans for what we might do. He looked at me as I told him this, and again, as always, he smiled. And then, "Doc, I'm ready," he said, not stopping, but going on to say, "I'll see you again, and I'll be waiting for you." I stood there stunned, silent. The next day, when I asked him if he was comfortable, he shook his head almost violently, side to side, and then he put his finger across his mouth horizontally, seeming to bite his finger into silence. And as I tried this, trying to figure out what he was doing, I noticed that I could not breathe, until I realized that if I stopped struggling to breathe through my finger, took a long, slow intake of breath in through my nose, that nothing but air would pass down my airway. No saliva, no sputum, just air. And as he settled into calm, we stood there quiet for a few minutes. I never spoke to him again. As we met with the family, decided to keep him comfortable, allowed him to see his son, his daughter-in-law, his two grandchildren together, his gathering. After he died, I spoke with his son, who sat by his bedside, accompanying him, until his 89-year-old father told him to go home, told him that later, someday, he would be waiting for him. At 4 a.m, he died, silent and alone, but not lonely. His regathering of the family, his nourishment, his composting, warmth over warmth. Through my earbuds in the front yard was the shouting, the disagreement, the noise of hopelessness. And as we got farther into the task, deeper into the backyard, and then jumped into the real work, the proximate, the suffering, we came into the silence and into the hope for whatever it is that comes next. Thank you for listening.
Thank you, Dr. Hatem. Yeah, thinking to those clinical settings when I just sometimes feel bad because I'm going to the bedside, almost for me, finding that hope there at the bedside with those patients to get away from the noise of everything else. But your story was great, as always, so thank you. Okay, our next speaker is Rosemary Kelley. Rosie Kelley is a fourth-year medical student here at UMass Chan Medical School. She is applying to anesthesiology residency and is excited about her future as a third-generation anesthesiologist. She's the oldest of 5, an avid fan of Harry Potter, and a loving dog mom to her rescue, Peanut. She recently married her high school sweetheart, TJ, and they are enjoying their first holiday season as newlyweds. Her favorite holiday tradition is watching Christmas movies, especially Christmas with the Cranks, with her family. She will be sharing a story with us called Silence, Reflections on an Organ Procurement from the Perspective of a Third-Year Medical Student. Thanks, Rosie.
All right. Thank you guys so much for having me. And here we go. The sudden silence in the operating room was unsettling. As a student on the transplant surgery team, I was taken aback by the silence when the team of anesthesiologists who had been providing physiologic support to the ASA 6 patient left the room following the aortic cross clamp of an organ procurement. I looked up to the black screen. A pit formed in my stomach as I processed the absence of the steadily beeping pulse oximeter and mechanical ventilator. I had come to associate the anesthesiologist's presence at the head of the bed and the sounds of anesthesia with the assurance that a patient was being cared for safely. The silence that morning signaled the absence of that safety. This was a moment of clarity, confirming my decision to pursue a career in anesthesiology. That was an excerpt from the opening paragraph of my personal statement for my application to anesthesia residency. While yes, this was really the day that set in stone my decision to pursue anesthesia, I'll also admit this is my hook. There's much more to this day that impacted me as a medical student and as a person. Navigating third-year clerkships presents a unique set of challenges. There's the obvious challenge of trying to translate our step 1 knowledge into clinical reasoning. There's also the constant concern about being evaluated at all times. Then there's the challenge of attempting to appear engaged without being annoying by asking questions, but only good questions at the right time. And finally, there's the strange transition from talking about burnout in our DCS course to observing how seasoned providers cope with the challenges of this field. I'd like to start from the beginning of this day to share a glimpse into the experience of a third-year clerk. It was a Thursday morning in early April, the second to last week of my third-year clinical rotations. Only 6 more wake-ups, I remember repeating to myself as I walked to the hospital at 4:30 a.m. I arrived and began the glamorous task of prepping the list for the transplant surgery service. At 5:08, my phone rang and the resident on our team was calling to invite me on an organ procurement. I was so excited to get out of rounds and go on an adventure. I hustled down to meet him in the ED. When I got in the car, the attending was kind and introduced himself, but quickly looked back to his work. It didn't seem like the time for questions, so I sat quietly. I didn't know where we were going, but I could see on the GPS that our ETA was 6 o'clock, so I figured we must be heading toward a Boston hospital. Eventually, the attending looked to me. "Would you like to read about the donor?" I nodded eagerly as he handed me his iPad. To be perfectly honest, I had no idea what I was looking at. I noticed a lot of pH readings before noticing the donor's age, 45. I continued to try to look for any information that meant anything to me, but really what I wanted to know was what happened. 45 is so young. I held the iPad for what felt like an appropriate amount of time to make it look like I was gleaning some useful information from this chart before passing it to the resident and using this opportunity to try to casually ask where we were going. I'm not really sure why I felt annoying asking where we were going. In hindsight, it would have been a totally reasonable question. In any case, I learned we were headed to Pennsylvania. Vague, but nonetheless, now I knew I was getting on a plane. I remember texting my med school group chat. I'm about to get on a private plane to fly to Pennsylvania to participate in an organ procurement. Each person shared excitement as they woke up, and I remember saying, this might be the coolest day of my life. We arrived at a small airport in Concord, Mass, and got straight on a plane with New England Organ Bank written on the side. There was no security. No one even checked my ID. I was filled with excitement. I listened to a review podcast about liver transplants on the flight and felt what I thought was completely prepared. We landed in Pennsylvania and I pulled out my phone, immediately pulling up maps to try to figure out where exactly I was. Just outside Pittsburgh, it turned out. It was a beautiful spring morning. Even being just slightly south of Worcester, spring was in full force here, and I remember seeing pink and white blossoms on all the trees. We arrived at a small community hospital and were brought straight to a crowded OR on the 3rd floor. There were 2 employees from the organ bank who mentioned they had both been up all night. There was also a very kind scrub nurse asking my glove size, and a circulator who didn't seem friendly but didn't seem annoyed by my presence, which felt like a win. We all made our introductions, and after a few minutes, the anesthesia team arrived with the patient from the ICU. I already knew the patient was 45, but he looked younger to me. He had a long beard, sleeves of tattoos on both arms, a tattoo of a tiger on his leg. I looked away. I wasn't prepared for the wave of sadness that was hitting me. I learned that this patient's daughter was a nurse who worked in this very hospital. This had been a horrific 48 hours for her. My thoughts flashed to my own sister, who's finishing nursing school, then to my father, who is well over 45. I quickly pushed these thoughts out of my mind as best as I could. We went to scrub, and I found myself growing nervous, despite this being the end of my surgical rotation that had been going really well. Before we started the case, the woman from the organ bank shared that normally at the beginning of these procedures, they read a few words from the donor's family. However, in this case, the family was too shaken up to have any words. 45, his daughter, the tattoo of the tiger. I pushed it down as I felt my eyes welling up. I looked at my hands. I don't know what was said for a few minutes after that point. I stared at my hands. I couldn't cry. What an embarrassing scene that would be. What if I got tears on the sterile field? I'd have to step away or scrub out. Both situations felt mortifying, and I continued to space out, focusing completely on the 2 layers of gloves covering my hands, until I heard, "Here, Rosie, can you suction?" And I allowed my mind to re-enter the OR. For a little bit, it felt like any other surgery. I focused on holding the suction, so I was helping but not in the way. I enjoyed the small talk, learning that we were in the hometown of Arnold Palmer, who evidently is a real person and not just the name of a refreshing summer drink. Eventually, we exposed the liver and the attending side. Looked normal-ish to me. The resident explained to me that the liver looked fatty. The cutoff for fats, or for micros, I then learned, was 50%. Anything greater than that meant the liver couldn't be used. We would need to wait for biopsy results. I was stunned. It's 2021. How do we not know this ahead of time? We continued working to expose the vessels, finding evidence of calcified pancreatitis throughout the patient's abdomen. This hadn't been documented in his chart at all and was not mentioned by his family. I thought of how painful this must have been, and I wondered if he had had a substance use disorder that he had suffered from in silence. 45, his daughter, the tattoo of the tiger. I pushed it down. Came time to perform the biopsy of the liver. This would determine that percent of macros. "Let's play the Price is Right," said the scrub nurse. "I'd say it's 60%. The attending and the resident both chuckled. "I'm an optimist," said the attending. 45. 55, said the resident. Suddenly, eyes were on me. "Rosie, what do you think?" I had a pit in my stomach. I thought about DCS. I thought about viewing the patient as a whole person. I felt awkward and nervous. I'm embarrassed to admit that I participated. 45%, I said. echoing my attending. I felt my cheeks turning bright red as I wondered if I'd ever think of The Price is Right the same again. There was a long pause in the case as the small community hospital had to process this complex lab work to determine percent macros. We waited in a sunny hallway outside the OR. I enjoyed my conversations with the resident and attending, connecting with them over the fact that we had all gotten engaged on a hike of some sort. We talked about this idea of working to live versus living to work. I nearly forgot what we were doing on this trip. Eventually, we returned to the OR after learning the liver was not acceptable for transplantation, as it was well over the 50% macros. I couldn't even begin to process the loss of this patient or the fact that I wouldn't be able to see this process come full circle when another life was saved. Even though our team would be leaving empty-handed, we stayed to complete the kidney procurement, something I learned is customary in the world of organ transplant. Around now is when we come back to the opening portion of my personal statement. The aorta was cross-clamped, the preservative infusion was started, ice was added to the surgical field. The anesthesia team turned off their monitors and left. In the midst of my attempts to grapple with the silence and cold, the well-intentioned resident pointed to the heart and lungs. "Look at this," he said, pinching a corner of the lungs. "This is atelectasis," he explained, as the lungs stayed compressed for a moment or two before re-expanding. "Try it," he encouraged. I felt uneasy but went along with it, compressing a small corner of lungs and watching them re-expand with a pit in my stomach. Next, he pointed to the heart. It was starting to look more like what I had seen in the anatomy lab and less like what I had seen in surgeries. "Feel it," he encouraged. 45, his daughter, the tiger tattoo, the pancreatitis. I felt my tears welling up again as I touched the heart quickly before pulling my ice-cold hand away. He kept pointing to the heart. "Here, feel it again. This might be the last beat." Did I really need to feel a 45-year-old's last heartbeat? I knew this patient was declared dead prior to this procedure, but I felt like I was watching someone die. At the same time, I really felt like this resident was coming from a good place. He was kind to me and trying to teach me. I didn't want to make him uncomfortable by sharing that I was uncomfortable. So again, I felt the heart, but quickly. It's been over 6 months and I still can't think of The Price is Right the same. I'm still not sure what the right thing is to do in these situations. I can picture myself before third year in DCS. I'd likely have said, I would never participate in The Price is Right, or I'd tell the resident that I'm uncomfortable holding a heart during its last few beats. And I'm sure there are students who would have, and I regret not being one of them. In hindsight, I'd be a little concerned about myself if this whole experience hadn't made me completely uncomfortable. As I transition to being a resident, I can only hope I won't lose sight of what it's like to be completely new to these complicated situations. Situations that reading books or talking about with our mentor groups can't really prepare us for. While there were many strange moments that day, I'm so grateful for this uncomfortable experience and the silence that confirmed my decision to pursue a career I am so excited about. I look forward to a lifetime of teaching and learning, growing through discomfort, and guiding patients safely through surgeries and critical illnesses. Thank you, everyone, for listening to my story.
Thank you so much, Rosie. I do remember getting that text about you going on the flight, and it's so, incredibly beautiful what you wrote. It really captures, I feel like, how often third years feel. So thank you so much for sharing that. So our next speaker this evening will be Dr. Heather Finley Mareale. Dr. Finley Mareale is a physician, writer, a physician, writer, patient advocate. She is an assistant professor at the University of Massachusetts Chan Medical School and a co-chair of the Committee on Equal Opportunity and Diversity Disability Subcommittee. Though she has scientific publications to her credit, she is most proud of her essays, through which she chronicles her experience in navigating the healthcare landscape as both a physician and a patient. Her essays have been featured in JAMA Neurology, the AOA Pharos, and featured blogs with a series of essays in Psychology Today, Kevin MD, Doximity OpMed, and Imitely. A recent advocacy work was a published letter in Stem Cells and Translational Medicine, which unveiled multiple transgressions, including promises of, quote, cures for autistic children in exchange for taking part in dangerous research. Dr. Finley Mareale says that she loves holiday decor in the wintertime, especially things with birds, hedgehogs, things handed down, and old things from Savers, as well as some other finds. She's going to tell us a story from this past summer when she was hospitalized and met her roommate Alice, through which she experienced a lifting of the veil.
Hi, everybody. I hope everyone can hear. So I was a patient over the summer at a big academic hospital in July, after people had had, a year and a half of COVID or so. And I think around day 6, 7, or 8, my head was ready to explode. There was a lot of communication failures among the team and, not a lot of follow through. And because of all of this, I ended up getting my vancomycin at 2 a.m. every night, and then my labs at 5:30 in the morning. If you've ever had vancomycin, if you don't smack the heck out of it, it beeps like every 2 minutes when you give it. So just file that away if you work inpatient. So, by day 7, after, nights and nights of beeping all night long, and my head about to explode, I kind of thought either security was going to have to be called, psychiatry was going to have to be called, or I was just going to elope and go out the door. Topped on top of kind of grief of illness and, grief from transitioning from mostly being a doctor to essentially being mostly a patient. So, and then Alice got wheeled in. Names are changed, details are changed, and honestly, I don't really know her name or any of the details, but she got wheeled in. Something unexpected had happened wherever she was, nursing home or wherever. And she came in by herself. Her family, they said couldn't come in until after work. They didn't expect anything unusual to happen that day. So she got wheeled in and kind of parked on the other side of the curtain. And every breath was just this gurgle. It was awful. She was literally drowning in secretions. And so palliative care came and nursing came and doctors came and a lot of people came. Oddly, she didn't seem really disturbed by it. She didn't gag. She just had this really awful sound. And she was there alone for, a lot of the time in between, getting checked on. And so I just listened to her because I figured, I could give some kind of feedback to the doctors and nurses about all the different things they were trying. So they ordered some kind of medicine, they left, and then her breathing got a lot better and a lot calmer. And she, would only kind of murmur if people were rolling her over. So I could tell the team, whatever that was, that worked. She, she's doing a lot better. And then over, a couple hours, she was calm. She wasn't really murmuring, with being contacted. And this whole time she had only said one word, which was actually an F-bomb when one of the RTs tried to suction her, which she did not like. And other than that, she was totally silent. And, it would have been easier to put headphones in and just block it out. It truly was one of the most unpleasant sounds I've heard. But switching over to the world of, not working and, being disabled and being seen as kind of less worthy, this was a time where I could, do something to help. So I didn't put the headphones in. I kept listening. And then at the end of the workday, the family came in and, every time someone new came in, they'd say, Alice, your ring, it's so beautiful. And then they would go on and on about the ring. And then the next family member would come in and they would start raving about the ring. And I was like, oh my God, if she passes, there's going to be like a pig pile, like a bridal flower toss. It's just going to be a nightmare. And it was also really odd. So, later on, I went to go to the bathroom and I saw that she was kind of doing this knitting and the ring was right there. So I just was like, okay, they're just responding to this movement. There's not going to be any kind of, fight over the ring. And I also noticed her feet, and it was really obvious that she hadn't walked in a really long time. They were kind of twisted and gnarled, and she definitely had not walked in a long time. And then the family left, when visiting hours were over, and she was on the other side of the curtain for the rest of the night. She was quiet. She was resting. I fell asleep, and then, well, it was still dark, 4:35 in the morning. I heard this, Heather, I want to visit with you. And I was kind of like, whoa, Like, does she know my name? Was she listening? Like, what's going on here? And then I figured out she wasn't talking to me. But for, a period of time, she just started greeting people like Heather, and then Marie, and then Ellen, and then Ed. And this was not hallucinating. She was, from the tone of her voice, she was reaching out and greeting and hugging these people, which I could tell from her voice on the other side of the curtain. So this went on for, about 90 minutes or so until dawn happened. And it was focused, it was lucid, it was a conversation. You could hear the pause when the other person was talking. Then about 90 minutes later, she went quiet again. And there were no other words the whole entire time she was there. And there's a phrase that I've heard people in my church, in my faith tradition, use called the lifting of the veil. And I'm a Unitarian, so there's people who are, grew up Christian, Jewish, Hindu, pagan, and actually on the altar there's all the different symbols, and you don't even want to know the battles that happened about like which symbol is on the top and which is on the bottom, and but people from all these different transitions had used this word, that the veil is thin. And I never doubted other people's experiences with it, but it never happened to me. But it is a time where the veil between the present world and the spirit world, the other world, becomes very thin, and you can hear and communicate with the other side. It's in the Bible, it's in Celtic tradition, Day of the Dead, Halloween. It's a concept that's been around for a long time, but it didn't really have a lot of meaning to me. And then the family came back, and at this point they had absorbed that this was probably going to be her last day. And unfortunately, there were no rooms. I mean, the hospital was full. She could not go to a private room. And, I was kind of waist deep in both their grief and their love, and I wasn't invited. But I also couldn't leave. I was hooked up to this vancomycin pole, all day long. And, they hugged her, they spoke with her, they prayed for her. You could just feel the love in the room that last day. And her death was a huge contrast to the first couple deaths I experienced in training. The first death was first or second year, and it was a young teenage male, wheeled in, shot playing basketball, lost his heartbeat right outside the ER door, came into the ER, had his chest opened. It didn't save him. The odds of him walking out the door cognitively intact were fairly slim. And, there were 3 traumas that day. There was the trauma that he got shot. There was the trauma of cracking his chest open. And then there's the trauma, of his mother coming in later and seeing her child, spread open. And, the whole room has the blood and the trash and the plastic, and, it just looks like, massive chaos. And that was the first death that I saw. And it was very different from Alice's. And then it kind of had this urge of do something. And same thing with, the next death that I saw. The resident, when the patient died, said, well, why didn't someone do something? Why didn't we do dialysis? Why didn't we do this? And, the urge to do something isn't always the good thing, and that medical acrobatics, might save a body briefly, but, they don't save the mind, and they don't save the spirit. So, I kind of wish all trainees had the ability to witness a good death if they haven't in their own families before they get thrown in the middle of this, chaotic, messy, traumatic, do something kind of death that I think a lot of deaths in the hospital are. So she gave me a gift, and I really felt at the end of that hospitalization where, my own care had kind of completely derailed, that I was there for her, that my purpose to be in that hospital, in that room, in that bed next to her as her roommate was the reason I was there. And she gave me a gift because I was able to be useful and help somebody in a, kind of medical caring way at a time where people weren't listening to me anymore. Once you cross from the doctor world to the patient world, and you're not working, you're less worthy, and then even worse, you're disabled, you're a time suck in your doctor's office. In fact, my PCP fired me at the time because she didn't have the bandwidth for disabled patients. So, you know, you just get kind of thrown on the trash heap when you leave the working world. So I was really despairing at that time, and she kind of relit my candle. And I think she helped me as much as I helped her. And her most significant event of the whole day, you know, this morning, that wasn't in the EMR. And if it had been, it would have said, you know, patient was delirious and hallucinating. She was not delirious. She was not hallucinating. She was having conversations because the veil was thin. So I hope, you know, there's some kind of programs or experiences where trainees can have this good death and a better first death experience where, you know, you do less, you listen, you comfort both the patient and the family. And I think that would really have a large impact. And it's what I wished I had experienced first.
Thank you so much, Dr. Finley Mareale, and thanks for your vulnerability, sharing your experience as a patient, and also the lessons you're able to learn and share with us as well. And thank you, Alice. Our fourth story, let's see, hit my notes. Our fourth storyteller this evening is Dr. Karen Rothman. Dr. Rothman is a retired dermatologist in the community division from the UMass Memorial Healthcare System and an assistant professor of medicine and pediatrics at UMass Chan Medical School. She has a passion for volunteerism and swimming, hiking, and cooking, among other things. And her favorite holiday/winter activity is snowshoeing. This evening, Dr. Rothman will share a story about someone who is wondering, will it hurt? Dr. Rothman.
Sorry, I just lost my Gordon. I'm coming. I just lost the Almost from the time he was born, my son Jeremy could successfully avoid doing whatever he didn't choose to do himself. So he was a preemie, born in the neonatal intensive care unit at Memorial Hospital. And he wasn't gaining weight. So the pediatrician said that we should increase his calorie count by supplementing his formula by 20%. And we did. And he immediately started drinking precisely 20% less. When it came to eating real food, his only food that he would actually eat was green beans, which had the distinction of being the baby food with the very lowest calorie count. He preferred them chilled, which was actually pretty helpful because it took him more than a week to get through that extra 30 calories. Perhaps because of all of the prodding and poking that he had when he was in the neonatal intensive care unit, he had a real aversion to any medical procedures, but particularly to shots. During my residencies in pediatrics and dermatology, I was taught repeatedly that children did not feel pain. So I had an opportunity to perform many procedures and watched others perform procedures, and these were often done without even the local anesthetics that were used when adults had the same procedures done. We held children down, and we were told that the children were crying because they didn't like that feeling. Parents were not allowed in the room because parents would learn to, their children would learn to associate their parents with that bad experience, similar to imprinting that would occur in baby chicks. And to ensure that we would learn this lesson well, our on-call bed, when we were in the nursery rotation, was placed in the corner of the well baby nursery to ensure that we could completely ignore 20 to 30 babies crying at the same time. My son Jeremy was born about 3.5 years into residency, and by then I had learned to ignore children's screams so well that when Jeremy came home from the hospital and fell asleep, woke up in the middle of the night, I never woke up. My husband had to wake me up to tell me that Jeremy was hungry and needed to be fed. 3 years later, I was hired as the first pediatric dermatologist in the UMass medical system. And I did lots of procedures on children, and I did them very successfully. But I understood certainly that delivering health care often causes our patients discomfort, but Jeremy's reaction to doctors made it impossible for me to do these procedures without at least some attempt to ameliorate that pain and discomfort. Jeremy's 4th birthday was coming up, and I told him I would be taking the day off, which was pretty unusual because I worked full-time. I told him we could do whatever he wanted, and the only thing that he wanted to do was to go to the dentist. Now, I was really trying to figure out why Jeremy was so excited to go to the dentist when he was so miserable with any other medical situations that he had gone into, and they seemed to be a whole lot less different. Getting a shot seemed much less difficult to me than getting a dental treatment. But it did make me think that my original thoughts that children really did feel pain and all that had gone through my residency, I really thought that there must be some way that we could make this, this better for kids. So I took a dive into the pediatric literature, and at the time I really found almost nothing there. When I was a resident, I had done some pre-market testing on something called Emla cream, which is a topical anesthetic, which does help a bit with pain control. And also I was able to read information about various oral sedatives that are available that could help children who are undergoing some of the longer procedures, but they really weren't very useful for the quick kind of procedures that are done on most otherwise healthy children that are outpatients. So I then looked to the dentistry literature, and I found many articles that were very helpful. Now, I don't think that pediatric dentists are innately any kinder or more concerned about children's welfare than pediatricians are, but I do think that they have more of an interest in not getting their fingers bitten, so they probably had more of a reason to figure out what worked. I learned lots of things. I learned about a lot of different distraction techniques that could be used. I learned how to outwit pain neurotransmitters by vigorously rubbing the skin. I learned that by increasing the pH of the injectable anesthetic that we could decrease or totally eliminate the burning feeling that we feel when we get an injection of lidocaine. And I also learned that there were ways that we could hold children that actually were comforting to children rather than making them feel like they were being tortured. So a few months later, Jeremy had to go to the dentist, that rescheduled appointment, and as he sat in my lap, the dentist told us that Jeremy would need a fluoride treatment. And the chair was tilted back, the room got dark, and the ceiling was filled with bright blue, shining, sparkling stars. And the dentist explained in a really calm voice that an especially magical blue star was going to be coming down right and taking a little explorer right in Jeremy's mouth. And Jeremy just sat there with his mouth open and let the dentist do the entire procedure without a peep out of him. And going to the dentist certainly was a little bit frightening and a little bit uncomfortable for him, but the dentist's magical way of explaining everything that Jeremy was going to undergo from his own perspective made it kind of exciting for him and turned it into a really positive experience. So I used many of these techniques, and I also developed some additional ones, always trying to keep my focus on how that particular patient would be seeing things. As a pediatric dermatologist, the most painful thing that I did in children was lasers. I was one of the first people to use lasers in children for the treatment of port wine stains. And these procedures were long, they were painful. Children's eyes had to be covered to protect them from the laser light, and the children were really completely terrified, and the procedures had to be performed multiple times, and every single time they came in for treatments, it was harder for them. Now, there were some physicians at the time who were doing these procedures under general anesthesia. I really didn't want to do that because I was concerned about the risks of repeated episodes of general anesthesia in these children. I really needed more effective tools, both to safely do the job and also to minimize the psychological trauma that I might be causing. So I took myself on a field trip to the toy store. And when I got to the doll aisle, I decided that the dolls were going to be my allies. And I picked up an armful of dolls made of different materials, and then I went and got crayons and markers and pens, and I brought them all back to the laser lab. I met my nurse there and told her she had to hold the fire extinguisher. And there we commenced some clinical trials on those dolls. And we did have a few mishaps. We had a few sparks, and we actually had complete meltdown of the Cabbage Patch doll. But we found that Raggedy Ann and Andy were absolutely perfect. They removed the port wine stains completely. The kids could crayon them on, and they did not cause any fires either. So after that time, every single time a new child came in to get port wine stain treated, I gave them a doll. They got to choose male or female doll. They could crayon on the port wine stain and hold it during the treatment. And at the end of the treatment, that's when the magic began, because at the end of the treatment, I had special, very small laser glasses that the children could use, and they could hold E.T.'s finger. That was a laser probe with a little red dot on the end of it, and they could laser off the Raggedy Ann's or Andy's port wine stain by themselves. Over the subsequent decades that I practiced medicine, I learned many new tools from others, and also figured out more tools myself. I found that gradually I was able to sense a patient's anxiety so I could address it really before they were aware of it. I told lots of stories and sang lots of silly songs, and these always had to end magically just as the final Band-Aid was being placed. I retired just before the pandemic, and since vaccines came out, I have been a volunteer vaccinator. And certainly kids scream and cry at times during these procedures, especially I think the about 9 and 10-year-olds who have to act like they're very brave. But last week when I was vaccinating, I noticed that one of the kindergartners had been just squirmy and thrashy and just totally out of control while another vaccinator was trying to get the vaccine into him. So I asked the child if I could help, and I brought over Buzzy, who is that vibrating ladybug or bee, depending upon which one you get that day. And I told him that Buzzy had a magical superpower, and his magical superpower is that his job was to tickle him until he made him giggle. And I stuck Buzzy in his hand, and he immediately started giggling. Within about a minute, Buzzy had managed to tickle his long sleeve shirt off of him, and he held Buzzy very firmly to his upper arm so that he could help with the magic of trying to make the shot hurt less. And then we marched Shotbuster up his arm, and then Shotbuster dug in his heels, and we got ready for the countdown. And by 6, the countdown was finished, the Band-Aid was on, and the child just took off my lap, and he ran to his friends to tell everybody how easy everything was and how it didn't hurt. Now, I don't think that the child is going to have a wonderful experience the next time he's vaccinated, but I do think that he did feel proud of himself for that day, and I think that the experience wound up being a bit more positive than it otherwise might have been. Seen from the patient's point of view, and sometimes even from our own, much of what we do in the practice of medicine is truly magical. It's wonderful when we can be the magician who brings healing along with comfort and sometimes even giggles.
Thank you so much, Dr. Rothman. That sounds like such a fun experience. You know, if I was a kid, it almost makes me want to, go to your vaccine clinic myself. So thank you so much for sharing that joy and reminding us of, how important it is to really think about your patients and consider what is important to them when you're delivering them care, and think about how things that maybe we think are routine can be really scary for children, and ways that we can be creative and make the experience better. So that was really inspiring to me. Thank you.
Thank you. Adults too.
Yes.
They need to.
Definitely. I'm saying, sign me up for your clinic. Thank you so much. Our next speaker this evening will be Samantha Rosenblum. So Samantha Rosenblum is a medical peds PGY3 at UMass Medical Center in the program's academic chief. She has a long-standing interest in narrative medicine and has been involved in the narrative medicine curriculum development for pediatric residency. Though her career plans are still open-ended, she is sure that she will continue incorporating the medical humanities and medical education into her next chapter. Her favorite winter activity is skiing, similar to Dr. Hatem, and doing the super mega puzzle from the New York Times. She'll be telling a story about shadowing during the holiday break of her senior year of college.
Thank you, Meg. So this story, I was a senior in college and I was getting ready to prepare my medical school applications for that coming summer, spring, whatever it was. And the last thing I needed was shadowing experience. So I reached out to my greatest mentor at the time, my biggest connection, my dad, and had him kind of help me find a doctor who I could shadow. My dad is a podiatrist at a hospital in Boston. And I figured, you know what, I'm going to be home for December break. I'll reach out to a bunch of his colleagues, I'll find someone, and I will get this shadowing experience in. And I was excited. I didn't really, know what to expect. I hadn't spent actually a ton of time in a hospital. But I figured this was the time to get it done. So I got connected with a vascular surgeon who was pretty intimidating. He had worked with my dad for years. He was an older guy. He was kind of scary. I would be going to the OR with him. I was kind of nervous, but nevertheless, I was like, you know what, this will be great. So I started my routine with my dad, which would be that I would wake up at 5 a.m, shuffle downstairs in my scrubs, grab a banana, get my winter coat on, get in the car with my dad, snuggle up on the side of the window, fall asleep, and my dad would drive us into the hospital. Not a bad gig for me. I had to wake up early, but I was able to sleep the whole ride in. And it was great. I was with the fellows and the attending, and we would round in the morning. We would, go do wound checks. We look at surgical sites. We would do dressing changes. And by saying we would do all of these things, I would stand behind them. I would hold a bin. I'd feel like I was like super involved. I was doing the thing. And they would explain to me what they were doing, and it was wonderful. I felt like in the way that kind of only a pre-med student can have, I was like, I am doing it. Like I am in it. I am, I've been waiting all this time. I've been taking all these classes, and like, this is it. Like I am doing medicine. And that was my perspective at the time. And so in the mornings, we'd see all the patients. On Christmas, we all wore Santa hats. I was like, I'm bringing joy. This is wonderful. I would go in the afternoons to the OR with the attending, and we would, it was vascular surgery. So I had no idea what I was getting myself into, but I saw all sorts of surgeries. So we were doing vein grafts after vein grafts. There were amputations. And again, by we doing them, I was not even scrubbed in. I was standing behind him, but he was explaining things to me. He was showing me what was going on. He was teaching me the anatomy, and it was great. It felt like really cool to be doing this. And again, like I had no concept of how I would kind of respond to this kind of thing. I'd never really spent time in a hospital, but let alone like an OR. I had never been in an OR, and going into it was very nervous, but I felt like, you know what, like I can handle this. Like I, passed all my classes, I did well. And now I know that I can handle being in an OR and seeing this like really gross stuff. Like, this is great. I'm doing it, and I could be a doctor. So then on probably the 4th or 5th day, I snoozed as much as I could, finally got up, finally got out of bed, got my scrubs on, ran downstairs, didn't have time to grab my usual banana, got in the car with my dad, got right in my usual position, really good co-pilot. And my dad turned to me and he said, you know what, I looked at the schedule for the day, and Dr. C doesn't have any cases until later in the afternoon. Like, how would you feel about coming with me to see one of my procedures? And I didn't really think anything of it. I was like, you know what, the team, I think they'll be okay without me. Can't say for sure, but they'll find a way to carry the bin, and all right, I'll come with you. And I really didn't think much of it. Just for context, I had grown up obviously in a home with my dad, who, HIPAA aside, did not believe in using a separate digital camera for our holidays and our family vacations, and then like pictures of wounds and amputation sites and like infections and all that. So growing up, I'd scroll back looking through our pictures on our digital camera from our recent trip, and you go back one too far and there is just like the grossest foot you could possibly imagine. But I was so embedded in it growing up that it like really didn't faze me. It was just like, this is my life. This is what our cameras look like. So it goes. So I go to the OR with my dad, and we get into the procedure room. He starts scrubbing in. The patient is lying in the little chair thing, and I'm standing to the side, as I want to do for this whole week. And my dad sits down, and I notice that this patient is not under general anesthesia, which is how all the other patients had been. And my dad starts injecting something into her foot, and she starts screaming. And I look at my dad, and he's still doing this thing, even though she's screaming. And then my dad pulls out his scalpel, and I turn the patient screaming, and all of a sudden I have that horrible feeling where my head rushes and it empties, and my vision starts tunneling in, and my stomach falls to my feet, and I think, oh no, I am going down. And I turn my head, I make eye contact with a nurse. She sees what's happening. She's seen this before. She grabs me. She like basically comes in right at the last moment, drags me out of the room, sits me down on a ledge, and she kind of rubs my back. She brings me graham crackers. She brings me apple juice. And then she has the very important job of tending to me, then running back into the procedure suite, telling my dad I'm okay, then running back to make sure I'm actually okay, and then going in and telling my dad, no, she's fine, she's fine. And for my dad, this was, I can only imagine, and I know because he's told me, a horrible experience trying to operate this was a bunionectomy. This was hardly the most gruesome thing I had seen all week, but I just couldn't handle it. Anyway, I was fine. My dad got through the procedure. I got through the procedure on the other side of the door. I did not try to go back in. So I learned a lot from this experience, from this week as a whole. I learned, I still came away with confidence. I still came away feeling like, you know what, I can do this. I can handle overall the gore and the guts and all that stuff, all the gruesome stuff, I can handle it. And in the wise words of my father, for the love of God, please eat breakfast first. Thank you.
Thank you so much, Sam. It's awesome. When you said Usual Banana, I was just thinking that would be like a great name for like a quirky band. But and now I will remember it forever as please remember to eat breakfast. It was awesome. All right. So last but certainly not least, our final storyteller for the evening, Dr. Michael Hirsh. He is a self-described New York City kid who grew up to be a pediatric surgeon and an accidental medical director of the Division of Public Health for the city of Worcester. But more formally, he is also professor of surgery and pediatrics at the UMass Chan Medical School and served as surgeon-in-chief of the UMass Mareale Children's Medical Center from 2009 to 2019. He was formerly the division chief of pediatric surgery and associate surgical director of the trauma center and the pediatric intensive care unit. He continues to serve as the pediatric trauma director and co-director of the Injury-Free Coalition of Worcester. His passion is in developing and applying innovative interventions to prevent pediatric injury. And he co-founded Goods for Guns, a firearms for gift certificate exchange program, which I believe just had an event this past weekend. Most recently, he was named Assistant Vice Provost for Health and Wellness Promotion at the UMass Chan School of Medicine. His favorite holiday is Thanksgiving, as he has so much to be thankful for, and his favorite winter activity is hiking in the woods with his dog and coming home to sit by the wood-burning stove, which just sounds delightful. he has a Christmas story called A Tale of Negative Role Modeling to share with us tonight. Thank you, Dr. Hirsh.
Thanks a lot, Tim, and thanks to all the storytellers tonight. Just fantastic. It's very hard to follow a group of 5 of you like this, so I'll do my best. I'm actually switching up the title to something in the spirit of Christmas, because it came back to me as a story that I had told for many years to the pediatric residency. I don't think I've told it during Sam's time as a resident, but here goes. So most of you know that the only children that are in the hospital at Christmas time are super, super sick. Every effort is made to keep them out of the hospital. So what you get left are really bad trauma patients, really bad cancer patients, patients that are in an abuse situation, a mental health situation, such that they don't have a place to go home to. It's a very sad collection of patients. The Child Life Service does a wonderful job in enlivening their lives. But the story I'm telling you is from about 10 years ago, and we didn't really have that much support in those days. I've been on every Christmas since 1978. When you're a Jewish guy, that's what you get. And once you're in practice with folks that aren't Jews, then you end up being a nice person and saying, yeah, why don't you take Christmas? I'll take New Year's, or I'll take Thanksgiving, or whatever the division of labor is, but I'm never off Christmas. And Christmas is never quiet for me. I never seem to be out of the hospital home watching It's a Wonderful Life. I'm always in the hospital doing something awful. And this particular Christmas that I'm going to tell you about was no exception, because I got called in for a level 1 trauma, the highest level trauma, at about 8 o'clock, that a patient was getting transferred in from an outside hospital, 6-year-old ATV injury. It's not a really good combination, 6-year-old on an ATV. And indeed, I worked on this child who apparently had flipped it in his first ride on it, right onto his head. When we saw the initial CAT scan on this very unstable little boy, whose name was Wyatt, we knew right away that he was imminently going to die of brain death. He had really, really bad swelling in his brain. It was almost to the point of herniation at the onset of our care. And we had to kind of gather all of our resources to figure out, are we going to get this young fella on Christmas Eve through the night to give the family a chance to process this, to gather, to say their prayers and hold hands, and maybe he'll leave us on Christmas Day? Or are we just going to give up right now? Because there was a lot of work to do. There were central lines to be placed. We had to put in a intracranial pressure monitor. We had central lines, all different kind of pressors were being used just to keep this kid alive. So I hadn't met the parents yet, because I was just working down in the trauma bay for like an hour and a half straight, and I was pretty tired already. I had to go out to the quiet room. That's that little room that we have outside of the trauma bay with no windows. And you go in there and you tell a family like this on Christmas Eve the horrible news that we think your son is going to be brain dead. It doesn't stay quiet very long. People tell you, get the hell out of here, go back in there and fix him. People say, how could you say that? This particular night, I said those words. The family went appropriately crazy. I don't mince words, because I think if you start saying patients going to the angels and all of these kind of platitudes, it doesn't sink in. You've got to let the patient's family make some critical decisions. So after about half an hour of having them hurl everything from epithets at me to just absolute begging me to go back in and make a different outcome happen, I walked out in the hallway, and one of the aunts came out and said, "I'm really sorry, Dr. Hirsh. My family just can't believe it. Would you like to see what happened?" And I said, "Really? I guess so." So this was a Christmas party that an aunt was having. There were many aunts and uncles and cousins running around in the backyard with a bunch of tiki torches, and it was a warmer Christmas night, Christmas Eve night that night. And of course, Wyatt had gotten his ATV that night as a gift. And so she had taken a movie of this. He got on this thing. He must have been on them before, because he knew how to turn it on. He turned it on. He went roaring down this path, flipped it over, and I watched it crush his head. And I got more convinced than ever that he was not going to make it. And I felt terrible. And I hugged this poor aunt. And I said, "Look, I'll see you up in the ICU. I'll be here all night. If you need me, just have the nurses get me. I'll come in frequently. I want to be there for you, but I'm just telling you, I just don't think it's going to be a good outcome." So I went up to my office, which is right across the hall from the PICU, and I had the door open. And I was just doing some emails and trying to catch up on some work. And about a half hour later, I heard crying in the hallway, which you frequently do in that hallway. And if you are there at night late, you'll hear it more when the parents come out to try to just decompress from their terrible day of sitting at the bedside. I thought it was going to be a family member of this little boy, Wyatt, but instead it was a senior resident from the pediatric department whose name is Becky. And I said, "Becky, are you okay?" And she couldn't even talk. She just said, "Mm-mm." I said, "Do you want to come in and talk?" So she came in. I closed the door behind her. I said, "What's going on?" He said, it's Molly." I said, what's wrong with Molly? Now, for background, Molly was one of those amazing 16-year-old girls who had great poetic skills. If she ever made it into a Zoom group like this, she would blow us away with her poetry. She was writing incredible poems all through the time of her diagnosis. She had a very, very bad sarcoma. She was at end stage. She had bilateral effusions in her lung that made her pulmonary status really tenuous. She was on very, very high flow oxygen. I had to put in a second chest tube earlier in the day because we just drew off this fluid because it gave her a little break. It only lasted about probably 12 hours, and then we'd have to draw off some more. The malignancy in her chest was just pouring out this very thick fluid. So I had just been in there probably 4 hours before to draw off another 500 cc's of this stuff. And everyone knew she was on her way out. And she had been pretty lucid when I was in there and always so kind. You know, like I was saying, "Did that hurt? No, doc, it's fine. It's fine." She was so kind to all the staff. But now she had gone delirious, said Becky. She was having these crazy hallucinations and conversations, and she didn't know how to talk her down and didn't know if she should try to talk her down. I said, well, what is she saying? She said, well, she keeps yelling out, take my hand, Wyatt. It's okay. We can go. We'll just go together. I said, did you say Wyatt? She said, yeah, who's Wyatt? I said, I'm taking care of a kid in the unit who's probably going to die tonight. His name is Wyatt. She said, no, don't tell me that. I said, I'm telling you that. How many Wyatts are there? Come on. So she said, well, what do we do? I said, I think they're doing it for us. About 40 minutes later, we were still sitting there. We got called. She got called to the floor. I got called to the PICU. They both had gone within a minute of each other. I'm telling you this because as I've gotten older, and certainly over the last 2 years, with the pandemic, there's been a lot of got to follow the science, got to follow the science. And I believe in that. Is when it comes to giving pandemic information, you got to follow the science and try to give people as true a picture of what's happening. But there are just some things I think in medicine and in life that I can never explain. And I don't know where Molly and Wyatt went that night, but I just hope someday I get to go there too.
Thank you so much, Dr. Hirsh. I can't even put into words how incredibly powerful that story was. I just can't even try to follow. So thank you so much for that story and for everybody's stories tonight. I mean, I'm always incredibly impressed by everybody and their ability to get up here and share something personal. But I think tonight, especially, everybody's stories were so incredible and had amazing themes of sort of the side of medicine that is the person and is more than just the disease process. So I feel very privileged to be young in my career, surrounded by such incredible examples. So thank you so much. And I will now thank you so much to everybody for tuning in. We're going to have another event, Med Moth event in the spring. So if you liked what you heard tonight, feel free to tune into that as well. And I'm now going to turn it over to Dr. Spanakis for the closing remarks.
Thank you, Meg. So all I can say is, wow, what a great evening. It's so great to be able to come together and share these wonderful experiences that you've all had. I want to thank the storytellers for their honesty and their candor. It takes a brave individual to tell these stories, and it shows what great clinicians and providers you all are. And I have the privilege of actually working with some of you, or having worked with some of you in the past, and all I can say is I'm not surprised. I think in our daily lives, there's a lot of pressures, especially clinicians, for efficiency, especially lately. And we're being pressured to see more patients and take care of more patients in the same or less amount of time. And it's really important to remember the person behind the chart or the person behind the story. And I think evenings like this give us a chance to do that, and to also remember to take care of each other, because we sometimes forget the impact that all these interactions that we have with our patients, what interactions they have with other providers that we work with. And we don't know what each individual provider is dealing with in their own personal lives or their own professional lives. And it's important that we support each other as we go through all this. I want to thank Tim and Meg for pulling this amazing event together. It was really, really wonderful. And I feel like I got to know the storytellers even better than I did before, even though I've known some of them for decades, like Dr. Hatem and Dr. Hirsh. So as we close our evening today, I want to thank you all for participating. I wish you all a happy holidays, and I wish you all a happy new year. Please stay safe. It looks like COVID is following its same path that it did about a year ago. So, we may be up against it again as the months continue. But thank you all, and stay tuned for information about future events of the Medical Society. Have a great evening.